All right, 'tis the season to get your flu shot. Let's find out about its benefits. There's plenty of them. Right now, we say hello to Sajjad Giby, who is the associate owner and pharmacist. Shoppers Drug Mart, couple locations, Bank and Heron, O'Connor Pharmacy as well. Nice to have you here, Sajjad.
Yeah, thank you for having me.
Busy time of year, I bet?
Yes, absolutely.
Yeah.
Very busy.
All right. What is the flu?
So the flu is influenza. It's a viral illness and commonly presents with muscle pain, high fever, very rapidly comes on, and can be quite debilitating for those who have other medical conditions or risk factors.
Because it is one of the top 10 reasons people pass away in Canada, correct?
Yeah, absolutely. Yeah, every year over 3,500 people die from the flu. So it's very important to keep in mind that when you get your flu shot, you're not only protecting yourself, but also those who are at high risk for severe complications. So the very young, the elderly, pregnant women, those who have other chronic medical illnesses as well.
Okay. So how effective was the flu shot last year?
It was highly effective, actually. It was over 70% effective for the most dominant circulating strains. But even that being said, we only saw about 1/3 of adults in Canada receive their vaccination.
Okay, because lots of reasons, I guess. There's lots of myths out there, I suppose.
Yes,
Yeah.
they certainly
What
are.
are some of the common myths that people think about when they think about the flu shot?
Thanks for asking. Actually, some of the most common ones we hear is that you'll get sick or get the flu from the flu shot itself, which it's an inactive portion of the virus. So you may have a little bit of mild sore arm, but generally most people tolerate it well. Second is that if you're pregnant, you can't receive it, and actually that's quite the opposite. It's recommended that throughout all stages of pregnancy, women do receive the flu vaccination. Lastly is that if they got it last year, they don't have to get it this year. And again, every year there's different strains of virus that can be common. So we really encourage people every year to just go out, come to Shoppers Drug Mart, come get your flu shots.
So it only lasts then 12 years, 12 calendar months. It doesn't last that long inside your body.
Yeah, typically the immunization works within 2 weeks. You start to get the immunity and typically lasts for about a year.
Yeah, so you got to get it every year.
Exactly.
Okay,
Yeah,
it's very important. Why are people so misinformed? Why do people think all these crazy things that you just mentioned?
Yeah, it's a good question. I think that we really have to do a better job of letting people know, letting the general public know. And that's part of our mission as pharmacists is to make sure that we increase the vaccination rates of influenza vaccine in Canada. So.
Okay, so that's the flu shot, and but there's other ways that we can maybe protect ourselves from getting that flu.
Yes.
And not only the flu shot, but what are some things that we should do on a daily basis?
So staying healthy and keeping healthy habits. So making sure that you drink plenty of fluid, eat healthy, exercise, get plenty of rest, because this just helps to boost the immune system. Staying away from germs. So washing your hands, sanitizing your hands, surfaces as well. Sometimes the flu virus can actually stay on surfaces for up to 24 hours. So using an antibacterial wipe to clean common areas. And then, of course, as we mentioned, getting the flu shot, which is probably the number one thing that you can do. So,
What is the flu shot made of?
So it's comprised of part of the actual virus. And they inactivate it, and they choose the most common strains that would be that they predict will be affecting people in each flu season. So I think this year we have 4 strains in there. There's 2 influenza A, 2 influenza B. H1N1 is in it this year as well, which was a pandemic a few years ago. So they use that as well to kind of predict what will be common.
Is there a risk of running out of flu shots?
So sometimes we do have some concerns surrounding supply, but luckily at the moment, we have adequate supply. There's no concern. It's definitely in the pharmacy at the moment. So would again say it's better to get it earlier in the season rather than wait.
Okay. So about 45 seconds left here, and I just want to go through maybe the steps of how to get the flu shot.
Yeah. So actually, one of the things that we've decided to do is try to make it easier for people to get it. Number one, there's no appointment necessary. You can come into the pharmacy at any time and get it from the pharmacist. And second, it's free. It's totally free. It's publicly funded. So just make sure that you bring your health card with you, and you can receive the shot that day. So.
Okay. All right. Any side effects?
No, generally, again, very well tolerated. Maybe some mild muscle soreness or mild fever, but most people are totally fine with it. They don't even feel it at all. So.
All right. Well, there you go. People should get their flu shot.
Yeah,
Simple
absolutely.
as that.
Yeah.
ShoppersDrugMart.ca/flu. Sajjad, thank you very much.
Yeah,
for being
thank you so
here
much, Dylan. Thanks for having me.
Get your flu shot. Simple as that. Have a good day.